We interrupt your normally scheduled program to bring you this public service announcement on malaria in Haiti. This public service announcement was brought to you by the Ministry of Public Health of the Republic of Haiti. Malaria is caused by a plasmodium called Plasmodium falciparum, which is endemic to Haiti. This plasmodium is classified as a parasite. The last reported incident rate of malaria in Haiti is 1,278 cases per 100,000 individuals. The vector for this disease, or disease-causing agent, is transmitted via mosquito bite, particularly the Anopheles gambiae mosquito. All it takes is one bite from this plasmodium-carrying mosquito to be infected with the plasmodium parasite. The incubation period, or period for which it takes for malaria to surface and become symptomatic, is anywhere from 7 to 30 days. Symptoms include malaise, or generalized tiredness, headaches, fevers, generalized muscle aches, nausea, vomiting, diarrhea, and cough. These also are consistent with the flu. However, if left untreated, malaria can cause kidney failure, seizures, and even death. There are many ways that one can prepare themselves for malaria. At the community level, one of the best things one can do is by eliminating the attractants for these mosquitoes. This means increasing sanitation and cleanliness, and decreasing carbon dioxide and smoke production, as mosquitoes are attracted to carbon dioxide and smoke. One recommendation is to not publicly burn clothing or any sort of item that may generate copious amounts of smoke. There are several ways you can protect yourself against malaria and malaria-causing mosquitoes. At the individual level, there has been a vaccine developed to help fight against malaria. Not only does this help to protect against malaria at an individual level, but this also helps with herd immunity, or the immunity of the community. Here you can see several vaccines have been released. In addition, one can use mosquito nets that have been laced with insecticide. These have been deemed as safe and are often used around one's bed. In addition, you can take anti-malaria pills or hydroxychloroquine, which can be used to treat and prevent malaria. Lastly, by wearing clothes that cover the skin, this helps to drastically reduce the likelihood of being bitten by the plasmodium-carrying mosquitoes. We thank you for listening to this public service announcement. If you have any further questions, please visit the Ministry of Public Health's website, or please refer yourself to any of these several references, which were referenced throughout this public service announcement. We now continue to your normally scheduled program.